Hi, everyone. Dr. Adriana Popescu here with you today with another episode of Ask Dr. Adriana on a topic that is probably relevant to most of us these days, which is the topic of self-care, essentially. Most of us are caregivers in some way, shape, or form. I work in the healing field, so I consider myself a caregiver in working with folks with their mental health. We have a lot of people working in other kinds of healing professions. If you are a parent, you are a caregiver. If you have a parent that maybe is getting older, you might find yourself taking care of them. You might be a caregiver for your dog, your cat, your horse, your animals. In some way, shape, or form, all of us are caring for someone or something else. But oftentimes it's caring for ourselves that we tend to overlook the most. And some of the things I want to talk about today include the idea of burnout, compassion fatigue, vicarious traumatization. These are terms that apply for those of us who are giving care to others, because it's so easy to get caught up in, without even really realizing it, when you have taken on basically someone else's pain and suffering. The topic of codependency also is relevant here. So I just want to talk a little bit about that and the scope of it, and then what can we do to manage some of these things and take better care of ourselves, because we actually are no good to anyone else if we're not taking care of ourselves. So let's start with the idea of some of those terms I talked about. So compassion fatigue, burnout, vicarious traumatization. Vicarious traumatization is pretty specific, I think, to those of us that work in healthcare. It can obviously also happen to people when they have loved ones that have been traumatized. But when I'm speaking here professionally, what I mean is I, for example, as someone who specializes in treating trauma, I hear really horrible stories all day long of the abuse and trauma that people have suffered. Oftentimes, I can be impacted by the stories that I'm hearing. I myself could experience, for example, symptoms of trauma just from listening to and being immersed in the stories of those who are suffering. So in the case of maybe a more personal friend or loved one, people actually can get PTSD, post-traumatic stress disorder, by witnessing someone else going through a traumatic event. If you see, for example, as a child, there's domestic violence in your home and you're seeing mom and dad fighting, or there's violence, you may actually experience the impact of that trauma in the same kind of way that the parents or whoever was involved did. Even though you were not directly involved, because you witnessed it, it can also have trauma effects, long-lasting trauma effects on you. Burnout and compassion fatigue is more like when you have given so much of yourself to others, there's very little left in the tank for yourself. And burnout can look different ways for different people. I know for me, when I'm burnt out, I get more cranky. I may have trouble sleeping because I'm thinking up at night, about all the different things and the problems and the issues that are going on. Exhaustion, fatigue is a big part of it. You'll often see people who are experiencing burnout or compassion fatigue turning to addictive behaviors like food or drugs and alcohol or smoking cigarettes. They might be doing more of that type of stuff as a way to kind of self-soothe or comfort themselves, which then can create more problems because, you may wake up with a hangover, or, you might feel sick the next day and not really be able to be present for the caregiving that you need to be doing. Burnout can also show up as conflict in relationships, or even withdrawing socially, depression, anxiety, losing interest in things that once were pleasurable. It definitely can take you down to a dark place. And I think we've seen, and there's been plenty of research done and plenty of articles, written about the state of burnout with healthcare providers in the last couple of years with the pandemic, with frontline healthcare workers, people working in the hospitals, when There was when we were being bombarded with, COVID and didn't know how to treat it and what to do with it. Nurses, doctors, hospital workers, teachers. Teachers experienced a lot of burnout with all of the chaos of the last couple of years with education. Parents have experienced burnout, staying at home, trying to, at the time when they were educating their kids, and also trying to work. For some people, I find, especially for the more extroverted people who really require being around folks in person, they really have struggled with this pandemic, with the isolation, with working from home, with not being able to go out and socialize in the ways that they used to. You can get burnt out from getting sick and being around sick people, being around mentally ill people. There's so many different ways in which it shows up. And I think we're having a real epidemic of burnout and compassion fatigue at this time. So one of the reasons I wanted to do this little talk with you today is to let you know that I actually, through my trauma treatment program, Firebird Healing, a good colleague of mine, Lauren Polly, and I have created a 6-part workshop where we're going to be talking more about these topics. And we've oriented it very much toward caregivers, especially those in the healthcare profession, because Lauren, like myself, works in healthcare. She's a speech therapist and works in a hospital. So she's been really frontline because with COVID, a lot of people had, lung issues and lost their sense of smell and different things. Maybe they were intubated and things. Anyway, so Lauren has real firsthand experience of being in a hospital setting, going through the pandemic and seeing her peers, just like I've seen my peers, really struggling with heavier workloads than we've ever had before. My practice has been so full with a wait list and a cancellation wait list. Like the demand for mental health right now is greater than it's ever been. So Lauren and I, as folks who are also holistic healing practitioners, have come up with some really basic self-care tools, some of which I'm going to share with you today, that we think are super helpful in allowing you to better manage the stress of your workplace or your home environment, wherever you're providing the care, and to also heal from some of the trauma you may have experienced as a result of your role as a caregiver. And so it's just, some of it is super basic stuff, right? If you've been following me for a while, I'm a big fan of working with techniques that help calm our nervous system, right? Because when we get stressed out, it activates what we call the fight, flight, freeze response in our brain. And fight or flight basically looks like an amp up. Your nervous system is in sympathetic arousal. Your heart is racing, you're sweating. You may be experiencing anxiety or even panic attacks. It's hard to focus. You can't think straight. You feel like you're going a million miles an hour. A lot of people, especially in those like hospital healthcare type settings, are experiencing that level of fight or flight. Freeze happens. It's our most basic survival instinct. Freeze happens when everything shuts down and you go blank. You check out, you dissociate, you can't speak, you can't think. It looks a little different. In the natural world, this survival mechanism is designed to help, keep us from getting killed by a predator. We're playing dead, hopefully hoping that the predator will leave us alone. These are autonomic responses that typically, we don't have control over. But what science and treatment has shown us is that we actually have tools and techniques that can help us to regulate our nervous systems, even to rewire our brains when we are constantly exposed to this type of circumstance, whether it's through trauma or just through this kind of high stress work setting. There are actually techniques we can use to calm our nervous systems down and to even rewire that tendency to be amped up all the time. So some of the tools are super basic. There are breathing techniques. I've certainly talked about those on Dr. Adriana before, Ask Dr. Adriana before. There's some videos on my website. There's certain breathing techniques we can do that will activate the vagus nerve and get our nervous system into a more parasympathetic state of relaxation. Meditation is super helpful. in our workshop, we're also going to be teaching some very specific yoga poses. It's very interesting that there's actually a whole branch of yoga now called trauma-based yoga. So there are poses we can take that allow us to release stress and trauma from the body, and those can be super quick and helpful. We've got tapping, EFT, emotional freedom techniques, right? Based on acupuncture meridians, the idea that we're stimulating acupuncture points on different parts of our body. And what that's doing is it's sending an electrical signal directly to our amygdala, which is the emotional center of our brain that is in charge of the whole fight, flight, freeze response. We can send a deactivating signal to the amygdala with tapping that, again, allows the nervous system to calm down really quickly. I mean, my joke with my clients in rehab, the drug and alcohol clients that I work with, is that you can calm your nervous system down so much more quickly with these techniques than you ever even can with your drugs and alcohol. They're faster than in the amount of time it would take for a drink or a pill or whatever to hit your system and calm you down. And this one comes with no side effects and no hangovers. So there's all of that. All of that is super important. So social support. That's another thing we're trying to create with our workshop, is to create a safe place where people can also connect with one another. Because again, when you're so focused on caring for others, you don't have time for yourself. You usually don't have time for exercise, eating healthfully, sleeping, or socializing. And socialization is a really important part of our mental health and well-being. So we wanted to provide a space where people could also talk with fellow, people who might be struggling with some of the same challenges. So feeling that sense of connection, not feeling so isolated or alone in your suffering is going to be really important. So connecting with friends, colleagues, a therapist, another healer of some sort is also going to be really key to taking care of yourself in these times when you are stretched thin. And I know it's so contralogical to think, oh my God, I've got to take care of everyone else. How could I possibly have time to take care of myself? We sacrifice ourselves, for the others. And this can, to some degree, go to codependency, right? Where you're always putting the needs of others ahead of your own. And that is a really unhealthy place to be. And there is support for codependency. There are actually 12-step meetings called Codependence Anonymous for those of us that might identify more strongly with those traits, because there also is a bit of a shadow side. I've spoken about codependency before on this show, and there can be a real shadow side to codependency that isn't very healthy. And certainly when you're neglecting your own well-being in favor of others who may or may not even want your care, it can really create a lot of problems for you. So, considering the possibility that you might have subconscious beliefs that say it's your job, psychologically, it's your job, like you are responsible for the happiness and well-being of others. Now, it gets a little tricky for those of us working in a healthcare field, because in some sense that, that is our job. But there's a way in which some of us, and I know I did this early on in my career, take too much of it on personally. We take the pain and suffering of others literally into our bodies in an attempt to heal others, to fix them, to make them better. And it's not really a strategy that works very well. I know for myself, it contributed to me getting really sick with Lyme disease and chronic fatigue syndrome, because my body, my immune system was not able to fight off the bacteria that came with the tick bite I got, because I was constantly taking on the pain of suffering in others. I was energetically enmeshed in everyone else's world, and really wasn't taking care of myself in the way that I needed to. So if you're a highly sensitive person, if you're an empath, this whole topic is going to be even more relevant to you. And learning strategies to manage your sensitivity, learning how to send back energies that aren't yours, learning how to not take on those energies in the first place is such a big piece of all of this and such an important part of what I do. I'm a big fan of Dr. Judith Orloff, who's really an expert on the topic. Dr. Elaine Aron, Aron, is another one. Dr. Orloff has written a really cool book called The Empath Survival Guide that might be useful for some of you who identify with that high sensitivity or being an empath. As many of us healthcare and caregivers are, makes it, again, even more complex for us in terms of taking on more than usually what we can handle. So that's something I really like to work with folks on as well. So wondering if there are any questions or comments on anything I've been talking about. Seems like we're good. So my invitation to you would be to really take a look, take a time out for a moment and really check in with yourself, check in with your body. Like, am I really giving myself enough time and care? Am I really, especially if you're a caregiver, am I at my best right now in terms of giving the care that I would like to give? Because I know all of us want to give the best possible care we can to the people we're working with or for. But am I really, you might need to take a hard look at it. Am I really at my best if I'm not taking care of myself? Like, I'm super aware right now I need a vacation. I haven't had a vacation in a very, very long time. And I can tell that there's some, signs of burnout that require me to take a vacation. And as I'm looking at when in the world in my schedule I can do that, in the meanwhile, I have upped my dose of exercise. I have done shortcuts in my life that will make things easier. Like, instead of cooking, I have meals come prepared, through those meal delivery services. And I just pop it in the oven and it cooks. And that's that. That's made my life tremendously easier. There are a lot of quick hacks and shortcuts. Getting your groceries delivered if you're able to do that. Like, simple things we can do that can offload some of the workload and make things easier for us. All of that can be super helpful. And taking a look at what else does your body require. This morning I woke up, or I actually had plans to wake up early and work out, and I slept through my alarm, which rarely happens for me, but that tells me that my body needed more sleep. So I let go of my mental idea that I needed exercise and acknowledged that instead what my body needed was sleep. And I took my time getting ready this morning, and that was my way of honoring myself. Like, we all need to learn how to honor ourselves and our limits. And too many of us are pushing ourselves past our limits at the detriment of our own well-being and ultimately the well-being of those we're caring for. So I do think it's incumbent upon us to take responsibility for ourselves and really give ourselves and our bodies the care that we need. So if this isn't a topic that you feel relates to you, if you have interest in seeing what Lauren and I have to offer, please check out our landing page. We'll put it here in the comments. Tools for the caregiver, tools to release stress and trauma when you're caring for others. So I think it'll be a wonderful opportunity for all of us to give ourselves a little time out, 6 weeks, 1 hour a week. We'll record it all if you're not able to be on live. This is really, even though we're saying it's primarily, for healthcare, we started off with the idea that it would be for healthcare workers. It really is open, I think, to anyone who's caring for themselves or anyone else. I think this is a workshop for everyone. So check it out, see if it pings for you. It's on the Firebird Healing website. Firebird is all about trauma healing and well-being, creating well-being for those of us who have experienced trauma, which in this day and age is pretty much everyone. So check it out. And we've got some freebies on the website too, which is really cool. I've got some of those videos showing some of the techniques that we're going to take a deeper dive into in the workshop, but I'm giving a general overview in some videos that I created if you sign up for the mailing list for Firebird. So you might want to check those out. And if you have any questions, feel free to message me. I do work with people in private practice as well. And I would love to create a world in which all of us are honoring ourselves and our bodies, and that will create a greater world for all. So thanks everyone for tuning in today. See you next time.